Hey guys, beautiful morning, beautiful afternoon, and beautiful evening to every one of you. How are we all doing? I know we are all doing fine by the grace of God. If you're meeting me for the very first time, my name is Violet Okolacha, and I actually talk about everything you need to know about your OSCE exam and nursing here in the UK. So if this is what you love, if this is what you want, sit back and watch to the end. All right, guys. So guys, today, because of popular demand, I've gotten about 7-8 messages about this regular. Violet, please, can you let us know some terms used in the hospital, sometimes used in the NHS trust, sometimes used, I keep getting them. So today I'll be talking about basic common terms used in the hospital here in the UK. All right, so but before we do that, it is very, very important in this channel for us to celebrate success. So guys, I'm super proud of you all who have passed your OSCE exam. Welcome to your band 5 roles, and like I keep saying, more than the sky is definitely your limit. The emails are massive. I have not read my mails. I'm not kidding, guys. I just keep saying thanks for your help, I pass, and just keep seeing some inquiries, a lot of passes. On my own student alone, I've gotten 10 passes. Yes, 10 passes on my own student alone. On my subscribers on Facebook, on WhatsApp, it's all passes. Oh my God, I celebrate with you who have passed your OSCE exam. And for those who are inquiring, having 1 or 2 issues, guys, don't worry, you're definitely smashing it. All right, so today I'll be talking about, like I said, common terminologies used in the hospitals here in the UK. So the first one I'll bring to your knowledge is MCA. You might want to hear, I think we should do an MCA assessment on this patients, or probably the nurse in charge can say, I think we should do an MCA assessment on this patient. What's your take? So when we talk about MCA assessment, we talk about mental capacity assessment. So mental capacity assessment is usually done for a patient. Probably the patient, you want to give the medication, the patient said, I don't want my medications. The patient cannot actually make adequate decisions regarding their health. They may refuse to take all their medications. So when a patient is behaving like this regularly, probably you say you're going for your x-ray, the patient said, I'm not going anywhere. Or can you take your medications, please? The patient said, I'm not taking. So when a patient begins to lack capacity to make decisions about their own health, it is really important we do what we call MCA assessment. And MCA assessment means mental capacity assessment. So when that is done and the patients, after you do your mental capacity assessment, it may not be decided that this patient lacks capacity. So when a patient now lacks capacity, you now do everything according to their best interests. You know what I mean? So you do everything according to their what? According to their best interest. As long as you've done a mental capacity assessment and the patient failed, you do everything according to their best interest. So you can forcefully give the patient drugs. You can do all of that because the patient now lacks mental capacity assessment. So you do everything at the best interest of of the patient. All right. So another thing I'll bring to your knowledge is DOLS. For instance, you have a patient in the ward that wanders. When I talk about wander, I mean a patient that can just get up and begin to move about. So that is why sometimes when you have patients who wanders, most times you see them and they are aggressive. You see them looking for care support worker one-to-one to look after the patient. So but these patients wanders, they move about, and you try to restrict them like getting one-to-one, and sometimes it doesn't work. Some of them can even move out of the hospital. You know what I mean? So, and each time they move out, you might want to call the police. And when you call them, the first thing they will ask you is, does this patient have DOLS in place? So the next common terms I will be bringing to you is DOLS, D-O-L-S. And DOLS means deprivation of liberty, safeguards. So if it's a patient that is always moving about, wandering, of course, all you need to do is to inform the next of kin and tell the next of kin, sorry, mom or dad is just moving about, mom or dad is wandering, doesn't want to take their medication, doesn't want to do anything. Even when we try to plead with them to stay in the hospital, he's just moving about. So we want to put mom on DOLS. We just want to seek your consent. So DOLS is usually deprivation of liberty, safeguard. So it means we'll restrict the patient to keep them safe. and appropriate, you know, keeping the patient safe and appropriate. So whenever the patient is leaving the hospital and you get the police involved, they will ask you, does the patient have DOLS in place? It's a legal document. So if the patient have DOLS in place, that gives you the right to keep them safe, you know, then they will take over and try to come back and, you know, look for the patient and get the patient back to the hospital. So DOLS means deprivation of liberty safeguard. All right. So the third one I also want to bring to your knowledge is BIM. So BIM basically means best interest method. Yes, so BIM is best interest method. So what BIM means is best interest method. So best interest meeting is actually a multidisciplinary meeting that is arranged for a specific decision regarding a patient. So when I mean it's a multidisciplinary meeting, it has to involve the doctor, it has to involve the nurse and every other team in charge of that patient's care. All right, so they meet together, involving also the patient's next of kin. So the patient next of kin has to be in that meeting with other medical professionals. So, and they take a specific decision regarding that patient. I'll give you a quick instance just to buttress the point further. For instance, you have a patient who is deteriorating very quickly. This patient is deteriorating very quickly, regardless of whether the patient is not for resource or for resource. And the medical team are like, can we have a best interest? Can we have a BIM meeting for this patient? So BIM meeting, like I said, is BIM, best interest meeting. So in the best interest meeting, they may not decide and take a specific decision regarding the patient. So sometimes they do a best interest meeting and it's okay, let's place this patient on end of life. So another one I'd like to tell you is EOL. EOL, how is this patient on EOL, please? You know, so EOL means end of life. All right, so when you place a patient on the end of life, you stop all the observations on that patient. Although the patient might have oxygen for comfort, but all the observations you no longer do for that patient here in the UK. You just make sure the patient is comfortable and you just give some pain medications to keep the patient comfortable, or some drugs like glycopodium, metazolone, just to keep the patient comfortable. All right, so another one I'll be bringing to your notice is pathway 0. So sometimes you might say this patient is for pathway 0. So when we say a patient is for pathway 0, it means the patient is going home without any care package. So when we say patient is for pathway 0, it means the patient is going home without any care package. All right, so then when we now say this patient is for pathway 1, so pathway 0 is PWO, meaning pathway 0. And like I said, pathway 0 means the patient is going home without any package of care. Another one you might want to see familiar in everywhere you work in the UK is PWL. PWL means pathway 1. And pathway 1 means the patient is going to their own house with either a single package of care or a double package of care or a TDS package of care. So the patient is going to their own house, but the patient needs support. So carers have to go to the patient's house to support the patient. So when we say with once package of care, it means carers have to go to the patient's house to support the patient once in a day. Then when we say with BD package of care, it means carers have to go to the patient's house to support the patient twice a day. And when we say with TDS package of care, it means carers have to go to the patient's house to support the patient 3 times a day. So it actually depends on the patient's condition. So sometimes you may see single-handed package of care daily or TDS package of care. But the main thing is when they're going home with pathway 1 or PW1, which means pathway 1, it means they are going home with a package of care. So that's POC. So POC literally means package of care. All right, guys, so I hope you're understanding it, and I'm trying to slow down so that you can also understand it. So another one I'll let you know about is PW2. So PW2 means pathway 2. So some people call this non-weight bearing pathway. Now what that means is you may have a patient you admitted in the ward that has fractured their hand or that has fractured their legs. So because they fractured their hand and their leg, when you have treated them and they are okay, you have to send them to a rehabilitation bed. So pathway 2 is literally like a rehabilitation bed. So rehabilitation bed is where you keep them and try to regain them to their function. So the patient had fracture of the hand. So before that fracture, the patient was moving the hand, doing everything. And now because of the fracture, the patient cannot do those things anymore. So you have to send them with pathway 2. Like I said, PW2 means pathway 2. You have to send them to pathway 2 to regain the function they had before they have that fracture. So it's actually on a short term. So usually some patients can be there like 6 weeks, 4 weeks, and as soon as they regain that function, they can now go home. So it's just like trying as much as possible for a patient who was independent. This patient does everything by themselves, and coming to the hospital after your treatment, the patient is now, is no longer independent. So you have to send them to pathway 2, which I said is like a rehabilitation bed, to take them to the former function they were. All right. So, and the other one I love to tell you is PW3, and PW3 is pathway 3. So what pathway 3 literally means is like a nursing home or a care home. And when we talk about a nursing home or a care home, it means the patient is staying there for a very long time. So when we say this patient is for pathway 3, so it means the patient is for pathway 3, going to a nursing home or a care home. And sometimes you may see when we say, do you have any medically optimized patients? So MOFD is another term I would love you to know about. MOFD means medically optimized for discharge. So when we say a patient is medically optimized for discharge, it means clinically the patient is fit. The patient is fit to go home. On the doctor's side, the patient is all right to go home. So sometimes in the hospital, when you have a patient that is all right to go home, medically optimized for discharge, but they are still in the hospital because probably they are waiting for POC, and I told you POC is package of care, or probably they are waiting for lifeline, or probably they are waiting for key save. So you have to, and maybe you have a lot of patient that needs to come into the hospital. So because here in the UK we have a lot of patient that needs bed, and this patient now is in your ward, and the patient is MOFD. And like I said, MOFD is medically optimized for discharge. So sometimes the site coordinators or the matrons might decide to send that patient to a PAU bed. So when we talk about a PAU bed means a pre-assessment unit. PAU is a pre-assessment unit. So most times patients waiting for package of care, patients waiting for lifeline, patients waiting for key save, because they are all medically optimized, but they are needing some support before they can go home. They are needing some items to be rectified before they can go home. Or probably a patient medically optimized for discharge but needs like a bed in their own house, or need like changing of equipment in their own house, and they need a patient to be in the bed because these patients are all well. So they might want to send them to what I call PAU bed. So PAU bed is pre-assessment unit. So they might want to send them there and take care of them there until they have their key safe, or they have their lifeline in place, or their package of care is now ready, so that they can now go home. Another thing you might want to hear a lot in the hospital is NFRO. NFRO means a patient is not for resource. We hear that a lot. So when a patient is not for resource, it means that if anything happens to that patient, the patient dies, or you notice this patient is not breathing, all you need to do is to call 2222 medical emergency. You can never do a CPRO on that patient. This is what I want you to really take note of. NFRO is not for resource. So if a patient has a red fall here in the UK, and the patient, you notice that this patient is not breathing fine, the patient is gasping, taking their last breath, all you need to do is, as a nurse, go to the telephone, call 2222, medical emergency, medical emergency, medical emergency. You mention the name of your ward, medical emergency, medical emergency, but you can never go and start CPR because the patient has a form NFRO or DNARO. So NFRO is not for resource, DNARO means do not attempt resuscitation. So which of them? They both mean the same thing and they are the same thing. All right, I'll be doing a part 2 on this as soon as I get the time to. However, tomorrow I'll be dropping a video on common errors in assessment, planning, implementation, and evaluation. You don't want to miss it. All right, guys, thanks for your time. Please don't forget to like this video and don't forget to share with your friends as well. I will see you in my next video, and until I see you again, keep passing your OSCE exam. I love you all, guys. Bye.